Hello, I'm Hannah, your student nurse for today.
Hello.
I'm going to go ahead and give you some privacy and do some hand hygiene. Can you please state your name and date of birth?
It's Blake Flowers. My date of birth is 02/25/2000.
Okay, and the doctor has ordered me to do a full head to toe assessment on you, so I'm going to go ahead and do that if that's fine with you.
Okay.
Okay, and I'm going to go ahead and ask you some questions. Have you been confused lately? No? Okay, and can you tell me where we're at?
My house.
Okay, and can you please tell me what today's date is?
October 2nd, 2020.
Okay, and then can you tell me who the president is?
Donald Trump.
Okay, and I noticed that he's oriented and he understands what I'm saying. He's giving me good eye contact. He can hear me. He's well groomed. And if I did notice anything or anything that's not normal, I would go ahead and assess with the Glasgow Coma scale, which would indicate brain injury the lower the scale goes. So I'm going to go ahead and start assessing with your head. Okay, and have you had any headaches at all? No? Okay, I noticed that his head is normal symbolic. And I'm palpating, and I notice no bony deformities or lesions. I notice that his hair is normally distributed. And then I'm going to go ahead and assess his ears. Okay. I notice that they're symmetrical to his face, and I notice that there's no redness, inflammation, or drainage. Have you been having any hearing loss at all?
No.
No? Okay, I'm going to go ahead and check your eyes. I notice that his iris is green, his sclera is white, and his pupil size is a 6. I'm going to go ahead and check with light. And I notice that it goes down to a 3, and I did notice that his other eye did constrict. So I'm going to go ahead and do accommodation. Can you please look at the end of my pen line? Okay, I notice that he does have accommodation. Do you wear contacts or glasses?
Where are those contacts?
You wear contacts? Okay, and when was your last eye appointment?
February.
Of this year?
Yeah.
Okay, I'm going to go ahead and check his nose. His nose does look symmetrical just looking at it. Okay, I noticed that he does have a deviated septum, which I will let the doctor know about that. And have you been having any trouble breathing?
It's a little harder to breathe through that nostril.
Okay, and that is the right nostril. I noticed that his lips are pink, moist. Can you open your mouth? His mucous membrane inside his mouth is pink and moist. I noticed that he does have good oral hygiene. And I noticed that his neck is symmetrical and midline. Have you been having any trouble swallowing? Or soreness in the throat, achiness in the mouth?
Nope.
Nope, okay. I'm going to go ahead and give him this water. Here you go. I'm going to get you to swallow. And did you have any difficulty swallowing? No, okay. I'm going to go ahead and check for JV distension. I don't notice any on this side. And then I don't notice any on this side. While I'm here, I'm going to go ahead and check for skin turgor on his collarbone. I notice that it is coming back to the skin. It's elastic. Okay, and then right here is your carotid pulses. Underneath your arm is your axillary pulse. This is your brachial, and then this is your radial. I'm going to go ahead and palpate this. I notice it's a 3 on this side. 3 on the other side. And then on the inner side is your ulnar pulse. I'm going to go ahead and do passive range of motion on his elbow. Can you please flex for me? Okay, resistance. Extend for me. Resistance. Okay. Flex for me. Resistance. Extend. Resistance. Okay, I'm going to go ahead and do his wrist. Okay, flex for me. Resistance, extend, resistance, and then hyperextend, resistance. Okay, flex, resistance, extend, resistance, hyperextend, resistance. Okay, He does have good range of motion. I'm going to go ahead and check his capillary refills. And while I'm here, I'm going to go ahead and check for his nails. And his nails are well groomed. And I don't notice any clubbing at his fingertips. And his capillary refills are reactive with 1 to 2 seconds of pressing down. I'm going to go ahead and check for edema. Okay, I'm going to go ahead and check for the temperature of his skin, which it is warm, but it's not anything to be worried about. It's normal temperature. And 3 risk factors for skin breakdown would be nutrition, dehydration, and personal health use to the skin. So I'm going to go ahead and tell you this is your femoral pulse, and then behind underneath is your popliteal pulse, and then down here is your tibial, and then right here is your dorsalis pedis. I'm going to go ahead and palpate the tibial. I would say this side's a +1. This side's also +1. Dorsalis pedis, I would say it's a strong +3. And then the same strong +3. Okay, I'm going to go ahead and assess his range of motion on his knees. So can you flex for me? Resistance. Okay, extend. Resistance. Okay. I'm going to do the same thing. Flex. Resistance. Extend. Resistance. Okay. I'm going to go ahead and check for edema in his legs. And then while I'm checking for edema, I notice that hair on his legs and his arms are evenly distributed. And are you having any trouble with any like skin issues at all? Nope. Okay. I'm going to go ahead and check the range of motion for his hips. So can you please stand up for me? Okay, put your feet together. Okay, and you can open up. Okay, resistance. Okay. Do the same thing. Resistance. Okay. And I notice that he does have good range of motion in his hips. Okay, I want you to go ahead and put your feet together, arms together, and close your eyes. I notice he has good balance. Okay, you can open your eyes now and stand over there. I'm going to get you to go ahead and do a heel to toe walk. Okay, you can turn around and do the same thing. Okay, that's good. And I notice that he does have really, really good balance. You can come sit back down. Okay. So I notice he does have really, really good balance, and he has no troubles doing that at all. Did you have any pain doing any of the walking or any range of motions? And have you been having any achy bones?
No.
Nope. Okay. I'm gonna go ahead and get you to lean back just a little bit. Okay. I'm gonna go ahead and listen for his heart sounds. Okay. I'm gonna start at the aortic, pulmonic, Erb's point, tricuspid, and the apical or mitral. And I would assess that for a full minute. Now I'm going to go ahead and listen to his lung sounds. So I'm going to go ahead and start at the right upper lobe and just take a big deep breath in for me. Left upper lobe. Left middle lobe. Right middle lobe. Right lower lobe. And left lower lobe. Okay, sit up for me. I'm going to do the same thing but on the back side. Okay, and I don't notice any abnormalities to his lung sounds, and if I did, I would use the bell. So have you been having any heart problems at all? or any trouble breathing?
No.
Okay. So now I'm going to go ahead and assess his bowel sounds and his abdomen. Okay, and I'm going to lift up your shirt. Okay, first I'm going to auscultate. Okay, and I did hear all 4 vowel sounds in all 4 quadrants. So now I'm going to go ahead and palpate, and just tell me if you feel any pain. Okay, and did you feel any tenderness there? No. Okay, I noticed that his skin color is normal with the rest of his body. I don't notice any distension or any lesions or bumps or anything like that. Okay, and when was your last bowel movement?
I think it was yesterday.
Yesterday, okay. And have you been having any constipation at all? No, okay. And have you been expelling any flatus or gas?
I guess.
Like excess?
No.
No, okay. And have you been having any trouble urinating? No. Any painful urination? And do you feel like you have an excess of urination? Yep. Okay. Well, I think that's it. And I'll let the doctor know and document all this stuff, and he'll be in here in a second.
Okay, make sure you let him know about my D-Wade supplement.
Okay, I will.